In this podcast, common vision disorders will be discussed. The goals of the podcast are a definition of vision, the components of our vision system, and an assignment. As we discussed in previous podcasts, vision is just not seeing, but it's a whole process involving the brain and most parts of the body as well. So seeing is a behavior, it's an experience. The eye is just not like a static camera. One of the important components of our seeing is the ciliary muscle that controls how the eye focuses on objects far away and then up close and then at any distance in between. And this muscle is trainable by using biofeedback. We can get the muscle to relax, we can get the muscle to increase its function. The focusing muscle, the ciliary muscle, is controlled by what is known as the autonomic nervous system, which does have a voluntary component. So we can teach people how to voluntarily control their focusing so they can actually zoom things to be clearer, and thereby we can reduce eyeglass prescription and other vision problems. Nearsightedness, sometimes known as myopia, happens when the light coming into the eye, an image coming into the eye, is focused in front of the retina. So people see more clearly up close than far away, and that's why it's called nearsightedness. Farsightedness is the opposite. The image is focused behind the retina, and people see better far away than up close. They see far better than up close, and that's why it's called farsightedness. Presbyopia is an age-related problem where people can see fine far away but have trouble focusing up close. Astigmatism comes from a Greek word where the A means not and stigma means point. Rather than getting one point image on the retina when there's astigmatism, there's two images. An eye that has astigmatism is like a football shape where we have one curve much rounder, much sharper than the other, and each curve will give a different focus on the back of the eye. One of the common vision disorders is glaucoma, when the pressure inside the eye is elevated and causes damage to the retina and impairs our seeing. There are 6 muscles on the outside of our eye that control our eye movements, and then there are muscles inside the eye that control the colored part of the eye, the iris, to open and close, and also this ciliary muscle, the focusing muscle, as we discussed before. Strabismus is a funny sounding word, but it's not funny when it happens. Strabismus occurs when one eye looks straight and the other eye turns in or out, and could lead to double vision, and is certainly a cosmetic problem. One of the most common vision disorders is convergence insufficiency, and here we see that the book is where the red lines, the red arrows are pointing, but the person's eyes are focused where the blue lines are, the blue arrows, and as a result, they will either see double, or they'll see a shadow of one image on the other, or actually the brain will turn one eye off to eliminate either the shadow image or the double image. And of course, this is trainable with vision therapy. As an assignment, assess the efficiency of your vision. Do you see better in the morning? Do you see worse in the evening? Do you feel, when you feel tired, is your vision blurry? When you're happy, is your vision better? Do visually demanding tasks make you tired or have a decrease in concentration? And do you enjoy reading or outdoor activities? Most people who are nearsighted enjoy reading and tend not to enjoy outdoor activities, and people who are farsighted enjoy outdoor activities and don't enjoy reading as much as the average nearsighted person. If you have any questions or comments, please feel free to contact me